I like to eat whatever I want to eat, but that's why I work out.
I like chocolate, but I have to be careful of that because I can get too much of it, and it's not a good thing.
Oh, occasionally I like French fries.
Well, as Latin people, we cook with a lot of grease, a lot of cholesterol, but we have to change those habits, you know?
I don't smoke, I drink, that's about it.
Unhealthy habits.
I think I do, but I try to keep them as a minimum.
I don't get enough exercise.
Maybe eating habits at times, sweets, sodas, things like that. But I'm trying to stay away from that best I can.
Well, welcome back to Balanced Health. We're talking about the things you can do to keep your heart healthy with Dr. Louis McKeever. And we were talking about some tests and things that we can do to kind of at least get an idea of what condition our heart is in.
Well, there's a lot of great tests that we have now that we didn't have years ago. The heart scan, which many people have heard about on the radio, is one of those. And the way that works is that it measures calcium deposits in the coronary arteries very accurately. When the heart, when cholesterol builds up in the arteries, the body responds to that by depositing little flecks of calcium. And these flecks of calcium can be measured by what's called an ultrafast CT scan. And it's a CT scan that's very quick. You can have this test done in 5 minutes. Wow. You don't take your clothes off, you just walk into a lab, lay down on the table, 5 minutes later it's done. And what it tells us is preclinical disease, meaning we can identify coronary disease much earlier than we can with any other test, including a stress test. A stress test doesn't become abnormal until there's at least 70% narrowing of the artery, whereas the calcium, the CT scan measuring calcium, there may not be any narrowing of the artery. So it allows us to identify a patient before he has any narrowing of the artery, and therefore we can put him on a regimen of healthy changes in his diet and his exercise and his lifestyle, and perhaps put him on medicines to lower his cholesterol if it's elevated, whereas we would never have gotten that patient in times past because he'd have a normal treadmill.
Or you would, but at the ER.
At the ER. Right. Well, you know, I'm so glad you explained that because I know our doctor, our general practitioner said, you probably should both go get a heart scan. My husband and I are both healthy. We have low blood pressure and everything. Cholesterol's good, but still, he said it's a good idea to get it. Now, if you go in and you get that heart scan and you find out, I've actually heard the advertisements on TV says, I went in, I had it, I went immediately and had quadruple bypass. So, I mean, that would be a worst case scenario, right?
Right.
But a best case scenario is, like you said, you can say, okay, there's a little buildup, you need to exercise more, you need to reduce the cholesterol in your diet.
Yeah, it's a call to arms.
That's good. It's amazing, really. That's miraculous when you think about it.
When you hear these things advertised and you hear heart scans, can the average public, can they be comfortable with the fact that they're all the same? Are there some cheap imitations out there? Or
there were some cheap imitations, but that has pretty much gone away. I think most places now that are measuring calcium scores are doing it with bona fide technology.
Does insurance usually cover that costs?
You know, it's iffy. Fortunately, it's not very expensive. You know,
how much do you think it costs?
You can get coupons, sometimes as low as $150. But I think the normal amount that is charged is around $280, something like that.
And for a major test, that's pretty inexpensive.
It is. It is.
What do you see in these scans in the way of, say, false positives or false negatives? Well, false negative might be hard to quantify until that person has a problem later on in life. Then obviously it was a false negative.
If we have a normal test, meaning 0 calcium score, the way that's interpreted is that means that you have a 0% chance of having a cardiac event in the next 3 to 5 years.
So you would have to, you need to repeat it about every 3 to 5 years?
After that, then all bets are off because life changes.
Sure.
Our bodies change. If you have a calcium score that's elevated, the more elevated it is, the higher your risk is.
Okay. Makes
What
sense.
number, is there a number that they would give that usually, deems intervention?
Like surgery or
Well,
something like
if we see a calcium score of 1,000 or more, almost all of those patients need to have a further investigation with a coronary angiogram. If we see a more moderate elevation, we'll follow that up with a stress test, usually an imaging stress test like a nuclear stress test or a stress echo. And the reason we do that is we want to know the calcium score is elevated, but it doesn't tell us if the plaque is narrowing the left vessel. Okay. So now we need a physiologic test to tell us that, and that's what the stress test does. So if the stress test shows that you have a problem, that will generally mean you have more than a 70% narrowing in the artery.
Well, Shirley and Dr. McKeever, I had a scan about 5 years ago, so I'm due again. And they called me on the phone with the results. They said, Mr. Costello, we have your test results. You got a 0 on your test. And I said, this is just like high school again. And they said,
that's
no,
a good thing.
in this case, 0 is a good thing. So when you say that if you have a 0 score, you have a 0% chance of coronary disease. So that doesn't mean, people could still develop arrhythmias and what have. There's still other heart issues you can have.
That's exactly right. We're talking about just coronary disease.
Okay. And what about stroke? I mean, that has nothing to do with your blood pressure or anything like that. Would it
it's
indicate?
the same process, only in different arteries.
Okay.
So if you have calcium in your coronaries, the chances are that you may have, and therefore you have atherosclerosis there, or buildup of cholesterol. Chances are you've got that elsewhere.
Okay.
So if you have it in your carotid arteries that go to your brain, then you'd have a risk of stroke. So they are linked because it's the same disease process.
We need to do a later show on stroke because it's just rampant and so
that
debilitating.
And they've given some signs now that anybody can learn
Right.
that can really help.
Right.
We have about 45 seconds to break. Doctors often tell patients they need an echocardiogram, and you get in front of this big machine, and there's all some really high-tech stuff, and I look at those things, and I can't believe how you guys can read them. It just looks like a bunch of stuff to me. What is an echocardiogram?
It's an ultrasound test that passes sound waves, ultrasound waves into your chest, and they bounce off the various structures of your heart, and then get put back into the transducer, and then through technology that I don't understand, comes out with an image. And it's a way to see inside the heart and inside the chest non-invasively. So we use it to look at the various chambers of the heart, the size of the chambers, how well the heart's contracting, and most importantly, the valves of the heart.
Okay, very good. Well, coming up in our healthy cooking segment, crispy French fries that taste just like you pulled away from the drive-thru window, and more with Dr. McKeever, so don't go away.